Good morning. Welcome to today's presentation titled Teen Substance Use, Signs, Symptoms, and Prevention. This webinar series is made possible by a grant award from SAMHSA, the Substance Abuse and Mental Health Services Administration. We are excited to provide this virtual series during the month of September, which is National Recovery Month. Today's session is being recorded and will be uploaded to the CMH YouTube channel for future reference. Please feel free to use the chat box to ask questions and add comments you have at any time throughout this webinar. And if time allows, we'll do our best to answer as many as we can at the end of the presentation. Our presenters today are Melissa Hunt and Shannon McKeever. Melissa is a program supervisor at St. Clair County Community Mental Health Child and Family Services Division, and Shannon is a substance use disorder clinician in the SUD department at St. Clair County Community Mental Health. And with that, I will turn it over to our presenters.
Good morning, and thank you for joining us. We're going to start our presentation with a video, so I'm going to go ahead and start that.
And if I did coke?
I'd be one of the guys. They said meth would help me get through my exams.
They said sniffing glue was no big deal.
Totally safe.
I could party all night.
They said heroin would be the best high I ever had.
It would help me forget my problems.
He said he'd love me forever if I smoked crack with him.
They said I wouldn't get hooked after the first hit.
They said that Ritalin would help me focus.
They said weed wouldn't lead to harder drugs.
They lied.
He lied.
Find out the truth about drugs.
Drugfreeworld.org.
Drugfreeworld.org.
All right, so good morning. And one of the reasons I choose that video is I really love that website. The website drugfreeworld.org has multiple resources within it. That's just one short video that is a beginning presentation to what they have to offer. There are multiple videos in regards to marijuana or heroin or alcohol. Basically any drug you can think of is in this series. And the nice part about it is from a adolescent perspective. So we will explore that website a little bit later if we have time. If not, it is in the references and it is just drugfreeworld.org. So we're going to start with talking about reasons why teens use. And we know they have a lot of reasons, but here's some of the top ones. One of them is to feel good or to get high. When teens are using, they feel good while they are using. They're not thinking about the long-term consequences that go along with that. Another reason is to relax or relieve tension. Think about when you were a youth and adolescent and how nervous you were and how worried you were all the time about, what do people think of me? What if I don't act right? What if I don't do this? So a lot of teens will use to kind of relieve that, to be able to go, okay, I can go into this situation and do what I need to do. For some, they like to reduce their appetite. So we know that a lot of our teens, especially when we talk about females, they worry about their weight. They worry about, am I thin enough? And so they start to use because they're like, oh, this drug makes me not hungry. Or to increase alertness. I have a lot of teens that have told me, I'm more focused, I'm able to concentrate, I'm able to do what I need to do, not understanding that the long term of that will end in a bad way. A lot of them use because they're experimenting. They're experimenting with the mental effects of substances. And so they want to see like, oh, my friend said this was fun, my friend said this was a good time, I'm going to go ahead and try it. So a lot of that experimenting is going on at this age. Some of them, if they've been using long enough, is to maintain the addiction and prevent the withdrawal. They use because they don't like when they stop using, they start having the shakes, they start not feeling well. So to maintain that addiction and to not have those feelings, they continue to use. Some of them use just to be accepted by peers or to be social. We know that when we hang around with people who do certain things, like if I hang around with people who go walking every day, the likelihood that I'm going to start walking is pretty high because I want to be with my friends and I want to do things that they do. So it's the same with smoking marijuana, using alcohol. If my friends are doing it, it's not so much the friends. I think a lot of people view it as friends going, oh, you need to do this, you need to do this, you know, you'll be cool if you do this. And it's not so much, it's more, I want to fit in, I want to be part of my peer group. And if this is what my peer group is doing, then I'm going to continue to do that. Again, some of our teens are using to improve their concentration. So we have a lot of kids who are, you know, they're studying for their SATs, you know, they're trying to get into that college, they're trying to get on that sports team, they're trying to increase their performance in whatever area they're interested in so that they can excel. And so they use these drugs so that they can continue to do more, be able to have more energy, more time to practice, to work harder. And so they don't understand the long-term effects of what's happening to their bodies when they're using these. When we look at adolescents, there are a lot of risk factors for adolescents. One of them are past and present addictions to substances. So, you know, they start using one substance. So maybe they're vaping, maybe they're smoking cigarettes. And then they're like, oh, you know, my friends are smoking weed, I'm going to go ahead and smoke weed. And then the weed's not cutting it. So now I'm going to smoke the weed and I'm going to have some alcohol with it. And then that's not cutting it. And so then they're like, oh, well, I heard, you know, heroin's a good choice. So some of those risk factors are that they've already started using. And so they're definitely using more. Youths are more likely to misuse drugs if they're diagnosed with major depressive disorder. And the reason for that is they're trying to alleviate their symptoms. And so they're really trying to find something that's going to pick them up, something that's going to make them feel good. And so that's another risk factor. Family history of substance abuse problems. So we know that if a family has that history, kids learn that coping skills. This is how I cope. You know, when mom gets mad and she gets upset, you know, she reaches for a drink. Seems to work for her, I'm going to do it. So that history can also be a risk factor. Exposures to peer or social environment where there's drug use. So again, like I said earlier, if I hang around with people who do this particular thing, the likelihood that I'm going to do that particular thing increases. Easier access to prescription drugs. So you really, really want to be careful. And whether you're a parent or you're working with parents, prescription medications really need to be locked up. I really can't say that enough. Even, you know, if you have something in your home that could cause, you know, if you have an opioid, if you have Vicodin, something like that, it really should be locked up. We want to make sure that kids are not getting into these. A lot of times they'll just take them and go, they don't even know what it is. They'll grab a blood pressure pill and not know and think, oh, well, I'm going to go get high with this. But we really want to be careful, and not only prescription medications, but over-the-counter medications too. You want to make sure that those are locked up and put away. It is the safest way to keep your prescription medications. If grandma has some, you know, leftover Vicodin from a surgery, make sure that that gets turned in. Make sure that you take that to the, what are those called, Shannon?
The sheriff's department dispensary.
Yeah, where you can return your unused, yes, depository. Thank you. Your unused medications. You know, I know a lot of people will, they'll be like, oh, I'm just going to keep this around just in case something happens. Well, really, you shouldn't. Once you're done, you know, and your 5 days is over of using that prescription drug, it really should be turned in. Another risk factor is chaotic home environments, particularly in which parents abuse substances or suffer from mental illness. And so when the home is chaotic and, people aren't paying attention because there's all this other stuff going on, it's definitely a risk factor for kiddos. It's really important for parents to be in touch with where they're at and what they're doing and who they're hanging around with in order to make sure that they're safe. Another risk factor is lack of parent-child attachments and nurturing. So we know our kiddos in foster care, they've had chaotic lives. They've been removed, they're in foster care. So their attachments aren't always what we would want them to be. And so we know that this is a risk factor for kids. If I have nothing to lose, what difference does it make? Another risk factor is people who are inappropriately shy. So kids who have no social skills, who struggle to make friends, who, just don't know how to behave like that, or they're aggressive. So then other kids don't want to be around them. So they try to find ways to cope with that. Poor social coping skills. Again, I really want to go to this party. I'm really nervous. I'm scared. So I'm going to smoke this joint before I go. I'm going to take that drink. I'm going to, use something to make me a little bit calmer. So we know that's a risk factor. Affiliations with peers that are displaying deviant behavior. So, kids who are high risk takers, the ones that are out, let's go steal a car, let's go shoplift, let's go do these things. So when kids are doing that, we know they're at a higher risk for using drugs. And perceptions of approval of drug using behaviors. So what I mean by that is so mom and dad smoke weed, grandma smokes weed, we all smoke weed. That's what we do. And so what's wrong with that? Well, we know what's wrong with that. It interferes with the development of children. It makes for bad decision making. So that perception of approval, you hear about the parent that says, oh, I let them drink in my house because that's safer. But that's saying it's okay, and it's not okay, because when you're under 21, it's illegal. So we know that these are other risk factors that increase the use of drugs. And the lack of knowledge about prescription drugs and their potential harm. Adolescents often think, oh, it's a prescription, it's safe, I'm okay. So we know that that's another risk factor. Moving on to protective factors. So there's things that protect kids. So strong and positive family bonds. So knowing, hey, mom cares where I am. Dad knows my friends. Mom's going to pick up that phone and she's going to call and say, hey, Susie's mom, are you having a party? Are you going to be there? Are you going to make sure? So those strong, positive family bonds are so important. Parental monitoring of children's activities and peers. I got one ahead of myself, but same kind of thing, making sure that our kiddos, that, they know we're there and they know we care and they know mom is going to call and make sure that I am where I'm supposed to be. Clear rules that are consistently enforced. So, the rule today is the rule tomorrow is the rule next week. My rule is that you have to be home by 11 o'clock. You're not allowed to drink. Those are the rules of this house and they don't change. So making sure that all those rules are very clear and very consistent. Involvement in the lives of the children. So, hey, there's a lot of parents that, I don't want to play video games with my kids, but that's what our kids do, right? So sit down next to them and play the video game. Watch the TikTok with them. It is such a great opportunity to do a teaching moment. I'm kind of old, so my kids used to watch the Jersey Shore and I would be like, let's talk about that. Let's talk about what's happening. We're 16 and pregnant. And I'd be like, let's have that conversation. Let's talk about, is this okay? Is it not okay? It's really being involved. And that means getting into their level of involvement. It's not what you like. It's not what you want to do. It's what they want to do. So trying to be part of that. Another protective factor is success in school performance. When kids are doing well in school, we know this is a protective factor. Part of that success is having things to connect with school too. So not just going to school to go to school. but being able to go to school, because I know I have band practice, because I know I have football practice, I have other reasons to go to school other than just because I have to. There are things that I enjoy. So success in school performance is a protective factor. Strong bonds with the institutions such as school, religious organizations, joining into youth group, joining a youth council advisory, finding things that are positive for kids to do that don't involve drugs and alcohol. We need to have things because guess what? When they get bored and they don't have these bonds, that's when they go, oh, I'm going to go use. Adoption of conventional norms about drug use. So basically just saying 21 means 21. You are not old enough to drink until you're 21. So agreeing with what the rules of society are and bringing that into your home. Some of the consequences of teen misuse. Multiple studies have found associations that the younger a person starts using substances, the more likely they will be diagnosed as an adult with a substance use disorder. And that goes along with the ACEs study. And I know multiple people have talked about that during the summit is, we know when people have certain factors that happen in their lives, they're more likely to continue using drugs and alcohol. We know the younger a person starts using, the less likely they are to develop healthy coping skills. And the reason for that is when they smoke the marijuana, it works for them. It works. There's no other answer to it. They smoke the marijuana and they're like, oh, I feel better. Not understanding that long-term effect. We know as adults and professionals and parents that this leads to other things, but kids don't understand that. And their brains go, well, if this works, I'm going to do it and keep doing it. So we know the younger that they start, the more likely they are to be diagnosed later in life. Other studies say that the younger a person starts to use, the less coping skills the person is able to develop. And again, it's because it works. It shuts down the brain. They just don't have to work very hard. I as an adult, I'm like, if they said there's a pill that's going to make you lose 40 pounds, have a good day, I'd be like, oh, all right. I don't have to exercise. I don't have to eat healthy. This is the easy route. And so drugs and alcohol sometimes become the easy route for our adolescents. Engaging in risky behaviors because of poor judgment. And so we know, when people use, we don't always make the best choices. We don't always go, oh, I probably shouldn't drive my car 90 miles an hour. I'm going to drive my car 90 miles an hour because now I'm impulsive. I've dropped all my, I've dropped all my inhibitions. I'm good. And so we know that these consequences lead to really terrible choices. They engage in riskier behaviors, and whether that's, driving the car too fast, sexual behaviors, talking to people they maybe wouldn't normally talk to, is just one of the consequences. Using illegal or recreational drugs. So the consequences of that is just not knowing what's in it, not knowing what they're taking, not knowing, there's nobody out there going, oh, well, here's your heroin and it's all nice and clean. Don't worry about it. Just go take it. They don't know. Synthetic drugs, they don't know what they're getting. And so we want to make sure that they understand the consequences of that. And remembering with adolescents, the fact of the matter is that adolescents will go, not going to happen to me. That's going to happen to somebody else, because they don't understand that it can happen to them. That happens to other people. So really having those conversations, really having those moments where, wow, did you see that news report about that kiddo? Did you see what happened to these kids when they stole that car? Having those conversations and keeping that door open. Consequences of being involved in crime, because guess what? When I want to buy drugs and I don't have a job, how do I get them? I have to steal. I steal from my family. I steal from my friends. I steal from someone else's home. I don't have enough money, so I will do sexual favors so that I can get the drugs. So there's this whole ball of yuck that goes along with these consequences. Motor vehicle accidents, like I said earlier, you're not thinking about, oh, I should put my seatbelt on. I should drive safe. I should be in the lane. I should not have 20 other kids in my car. We know the increases of that. Decreased academic or work performance. That's exactly, we know as people use, that all drops. Troubled relationships. So for adolescents in particular, when they're using, they often have to lie to their parents. They often have to, they're not going to keep their relationships with their friends. They're not using the best judgment. So, their friendships suffer from all of this. Things they may have been involved in, like if they were involved in a sport, if they were involved in a youth council or a youth group, they may not do those things anymore. So they lose all those relationships, all those supports that they had. All right, so some signs and symptoms of drug use. So one of them is constipation. And some of these, going through this list, it can be difficult because it could just be a medical issue. So I always encourage parents when they come in and we're talking about different things, I always say, have you had a medical exam? Have you been to the doctor lately? Have you been to the dentist? Because sometimes the doctors, dentists, they pick up on some of those things. Because if you're smoking meth, your teeth are going to suffer from that. So the dentist will pick up on it. Your primary care physician might pick up on something. So some of these things just sound medical, and they could be, but getting it checked out is always the best option. So nausea, feeling high when you're just, from the use of the drugs. Slowed breathing rate. So we know, when people are having an overdose, part of that is your breathing rate slows, your heart rate slows. Slurred speech. If you see your child having slurred speech, what's going on with that? Drowsiness. Now we know that adolescents, they get sleepy, they sleep a lot, or they sleep too little. It kind of goes back and forth. So really what you're looking for when you're doing signs and symptoms too of teens using is what's different, what's changed. This is a kid who usually was out running around all the time, playing baseball, blah, 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 and all of a sudden they're sleeping all the time. Or this is a kid who didn't have a whole lot of energy, and now they suddenly have a ton of energy. So we're kind of looking for what has changed with this kiddo. Confusion, they're not able to tell you what they did or where they've been. Poor coordination, that you start seeing bruises on them, they're falling a lot. Increased dose required for pain relief. So, you're giving your kiddo, here's a Motrin. Well, mom, Motrin's not cutting it. So watching for that. Worsening or increased sensitivity to pain with higher doses. Change in eating habits. This is a kid who normally ate all the time. Now they're eating nothing. This is a kiddo who, ate very little and now they eat a lot. Flushed skin, dilated pupils, changes in school performance. So again, this is a kid who normally had B's and C's. Now they're getting D's and E's. So making sure we're keeping an eye on that. Anxiety or difficulty maintaining focus. And again, back to, remember I was talking about, kids who are taking their SATs or getting ready to try and pick a college, or, this anxiety is so high and they really aren't focusing anymore and they're struggling to complete tasks. So those are the kinds of things that you're looking for. Expression of suicidal ideation or suicide attempts. Because again, we know that risk goes up when using. Poor judgment and rule breaking. They're just, again, they're doing things that they wouldn't normally do. Some of the things you want to listen for, and these are just some names. So some of the street names. So like Adderall, you might hear kids talking about Addies, uppers, beans, black beauties. I'm not going to read them all. Bath salts, vanilla sky, white lightning. The synthetic drugs oftentimes have these names like, oh, it's purple haze, it's blue cloud, they sound like they're things. And so just be listening. And again, this is back to being involved. Hear what your kids are saying. Pay attention to what's on social media. What do they have out there? They often think sometimes we don't catch that. So if you hear them talking about cough syrup, DXM, they call it Drex, Robo, poor man's ecstasy. Marijuana can fall under weed, pot, hash, take your pick. There's lots of those. Xanax, the Xannies and the bars, that's another one to listen for. Vicodin, bikes, idiot pills. And then there's the synthetic marijuana, so spice, K2, Oxycontin, you know, hillbilly heroin. I've heard that one a lot. Mushrooms still, I hear a lot of shrooms. That's usually the word I hear, shrooms. Inhalants, you know, and we haven't talked about a whole lot of those, but our middle schoolers are very prone to being the ones who use the inhalants. So using the duster for the computer or cleaners that we have in the house. So just make sure all the whipped cream can, that's always the one I always want to point out, because, you know, there's CO2, right, is what's in the can?
Nitrous oxide.
Nitrous oxide, thank you.
So if you don't shake it and you just use it.
Yep.
It doesn't. So you have cans with whipped cream in them, but no anything to get it out.
Yes, yes. So, and I believe it's the same thing that they use for the drinks when you make the cans for the drink. I'll come back to that afterwards if we have something later. Some things to look for when you're looking for evidence of drug use. So things like empty capsules, liquor bottles, needles, small plastic bags often used for huffing. So usually you'll find a plastic bag, it usually will have cotton balls or paper towel, maybe a washcloth, and they'll put the chemical on there and then use the bag to huff. Empty pill bottles, cotton balls, which I just explained, razor blades to chop drugs up, straws to snort with, empty pen. You start seeing pens that are all over the place. Lighters, matches, extra long shoelaces are a tie off to so that you can get a vein. Rolling papers, blister packs. Oops. Sorry, I went too fast on that. But those are all things to really keep an eye out for. And if you find cans that have a hole in them, like a pop can, definitely can be used for smoking. So where are they likely to hide it? Well, here's the thing. Amazon has all kinds of things you can buy to hide things in. You can go to any local smoke shop, liquor store, anywhere to find things to hide in. So be diligent. Know what know that you need to look for things. So hide them in shoes, candy wrappers, highlighter weed pipes. So they use the highlighters, tampons, in their books, lip balm containers, mechanical pencils, water or soda bottles. Like if you look on the side here at these cans, those all come apart. Also putting vodka in a water bottle, any clear liquor in a water bottle is another way. Gummies, they soak gummies. So be careful of those things. So many edibles out there. I just saw in the news yesterday that there was a store that was selling edibles that were like Cheetos and Doritos and looked like.
I just heard from somebody that they went over to a friend's house and they they were eating dinner and they had a bowl of rice and the rice was edibles and they didn't find out until afterwards. Like it was somebody that would have indulged in, but they didn't find out until afterwards that rice. So they ate more than they probably would have because they didn't realize, and it's rice.
Right, who would have known? Yeah, the edibles are out there and there's lots of them and they come in a lot of different forms. And so be careful when you're eating things or eating in places you're not aware. It can be in a hairbrush, in their locker, in their gym locker, sports bags. So all kinds of places to hide things. So I will stop and just give us 1 second so we can switch our microphones here and I will hand it over to Shannon.
Unmuted.
Not yet. I'm gonna turn off my sound.
All right. There we go. So I'm going to kind of talk about a little bit towards some of the information that we've gotten. St. Clair County did a survey of our teens in our local area. And so in that, they found out a lot of information about what our kids are doing. So this is just a chart from some of the information they received back from that. And it just kind of talks about like 49% in 2016, 49% of kids, our teens or adolescents had high school students had used alcohol. It actually, as you can see in this, I was very interested in seeing that how it decreased from 2016, 2018, 2020, because they continuously do this survey to see what's going on in our area. But these are our kids. And so these are the kids that we have in St. Clair County. So as a parent, as a person that works with children or a person that works with parents, you're to be aware that, you know, we're looking at 14% of our teens had used alcohol before the age of 13. That's a significant amount of our children in a very, in a part of their brain development that's creating that higher level decision making. They're adding this chemical during that time. This is their time that they're learning the coping skills of socialization. They're learning the coping skills on how to deal with when life throws you a curveball. And they're adding a substance and using that substance in place of a lot of the times the coping skills that we would develop in other types of developmental phases, and when people that don't use are developing those. So, you know, when I'm working with adults, because I work with both teens and adults, but when I work with adults, that's mostly for substance use, I go back to talking to them about how when they started using as teens, they missed this piece because they're starting to use at age 13. They're starting to use at age 15, 16, 17. And so they missed that piece. So you really are reverting back to that adolescent stage to then develop the coping skills. So not only are you fighting your addiction and trying to come out of active addiction, but you're also trying to learn skills that you're looking at your peers and comparing yourself to. So, you know, they're 30 years old and they're like, why can't I do this? Well, because developmentally right now you're 15, because that's where it started. So that's another consequence of use starting in our adolescence. Here is about, you know, they broke it down by grades and different substances. So 7th grade, you notice there are people that are using. I mean, we've got some of our kids that are using. 6.7% talk about using vapes, 2.6 are alcohol, 2.2 marijuana, and then 3.7 are prescription painkillers. So these are where these kids are starting in 7th grade. Then you look in 9th and there's a jump, and then again in 11th grade. Especially when you're looking at that alcohol, marijuana, and the electronic vape products. So when we're looking at this, again, looking for those signs, those symptoms for our children on what's going on, being connected enough with them, having those conversations with them, being open with them about even the things that we might have done and what our consequences were when we were younger, because that's something that I think is important, is to be transparent. So we're human, so then they can understand, but obviously in a PG format. So we got to make sure that we do it developmentally appropriate, but having those conversations as parents or even as clinicians with our teens, having those conversations with them, letting them know that, you know, people aren't perfect. And also we have to do the best that we can. This is the information. This is what you're doing. I know that it's not going to happen to you, but you know, when you get drug screens back, because I work in a department where we do drug screens and we even send them out. When somebody says, all I did was, and for them, all I did was meth, or all I did was I was smoking crack, and then they come back positive for fentanyl, they're like, where did that come from? And they don't realize that fentanyl is cut into a lot of stuff now because it's cheap. And people aren't understanding that in our area, that's pretty significant. So marijuana is one of the most abused drugs in the world. This kind of talks about where it comes from and what it looks like with marijuana. Obviously, for people that are aware of it, THC is the component that gets you high in marijuana. So that's found mostly in the bud. You're not finding it in other areas of the plant, but so you have this THC when you smoke a joint, or if you smoke a bowl, or if you're using a bong or something. You can also get like hash out of it, that resin that's kind of like sticky in the pipe itself. That's a more concentrated version of it. So they'll start to smoke that, or they'll put that in foods to be able to eat. They talk about joints. Joints are, the common word for a marijuana cigarette, but you'll also might hear a blunt, because what they do is they take cigars, they cut cigar papers, fill it up with marijuana, reseal it. And so, you're getting like fat marijuana blunt joints to smoke. So that's a significant amount of marijuana that you're smoking when you're using that. Dry pipes or water pipes, known as bongs. So if you hear these words, or if these are something that you catch in conversation, just kind of keep an ear out. And then edibles. Edibles, as Melissa said, they come in all kinds of formats. There's dispensaries that you can go to. If you're over 21, you can get these edibles. The THC content is so significantly high compared to like if you were going to smoke marijuana. Marijuana is very different than it has been in the past also, because it's been designed to have a higher THC content. So one thing that, I've found that I'm completely uneducated on, and people have been talking to me about, and I'm learning more and more about, is when they talk about, hey, that had 100 milligrams in that cookie of THC. I'm like, what does that mean? Because, I remember, back in 1992, sorry, I'm old, but that there was no such thing as milligrams of THC in something. We had no idea, like there was nothing in that. So the knowledge that we're continuously gathering, even as a clinician that actively works with people with substance use disorders, this information that we're getting and the education that these adolescents have on milligrams of THC and CBD and the components and the types of, indica, and, you're talking about all these different words that I'm like, excuse me. But again, we need to educate ourselves when we work with teens, when we have teens in the home, because without that education, we're not going to know what they're talking about. And it would, if somebody's talking about, yeah, I'm going to go get indica, you might not know what that is. You might think it's something other than a type of marijuana. So again, being just aware of marijuana, the terminology that's around, and this just gives a little bit of information on that. And it talks about how joints can be laced with crack or PCP. They can be soaked in formaldehyde, which is another thing that people will get high off of. There's other things that they're doing. The papers themselves can be soaked now. You can get flavored papers. It's a very interesting dynamic there. If you are a parent, or even if you're a clinician and you're over 21, I'd suggest to even go into a dispensary and check it out and see what they have and see what things look like there. Just again, to get that knowledge, because these are the people that are selling it, and these are the people that are educated in it, and ask questions, because that they're a wonderful resource for a base of knowledge about marijuana now. And unfortunately, because it's become legal, it's minimized in what's actually happening to our teens when they're using that and how that affects their development, because it's legal now. So that's one of their favorite things to tell me. So Adderall, these are some examples of what Adderall looks like. It helps with people with ADHD. Some children are prescribed Adderall. I know some of the prescribing practices have kind of come away from that because it is a controlled substance, stimulant, and also it is still out there and people are still being prescribed it. Kids will use it to stay up to study for exams. People will use it to be able to have enough energy to play a sport, for football, running plays, and basketball, weightlifting. All of these different things will help. It helps focus in. It helps you be able to have this energy. Again, it's a stimulant. It's like drinking, a ton of coffee and your body's shaking and you've got all this energy and you need to get it out. So you have this ability to focus, keep in on a subject, stay up all night to be able to cram for exams, stay up all night to cram for the SATs. So these are things to be mindful of. So it's not even about just your child having that medication and keeping it locked up, as Melissa had said, and monitoring it, how it's dispensed, but also about if their friends have Adderall, because it's very easy to say, well, you know what, I'm really stressed about the exams. Hey, you want one of my pills? And your child is starting to use Adderall because it works for them for what the purpose they're trying to do, as Melissa had talked about. It has an abuse potential. It enhances cognitive and physical performances. Adderall is misused as a recreational drug for an academic enhancer and performance enhancer by athletes. Nearly 42% of high school students say it's easy to obtain Adderall or other stimulants. So that's just something to be aware of. And as I said, I work with adolescents and I also work with adults, and I've seen how people talk about the transition from Adderall to meth and how that can be a trajectory. So starting out with Adderall, which is just for studying, can then increase and turn into something else. Prescription opioids. Prescription opioids are prescribed by doctors to treat moderate or severe pain. Common types, you have Oxycontin, which is like a higher one, Vicodin, which are also called Norco, hydrocodone, morphine. Methadone is something that's used to be able to help treat opioid addiction, but it's in and of itself something that's very difficult to withdraw from and to come off of. So if it's something that you're exposed to or start to use, that's it's something that needs to be addressed, even if it's considered med-assisted therapy. That needs to be monitored significantly by a health professional. It's not something that you can do on your own. You're also looking at not only, you're looking at your hydrocodones and your oxycodone, but people are using kratom now. Kratom affects your body very similar to opiates. So that's something else to be very aware of. I know that you can buy it at a lot of stores. It's over the counter. People think of it as a natural herbal remedy for things, but in reality, when it breaks down, your body treats it very much like an opiate in your system. Prescription opioids can be prescribed for injury after surgeries, health conditions. Many people have had them pass through their homes. And as Melissa had said, if you just keep it just in case, then here you are with this medication that people, a medication of abuse, that if your child has a headache, they may take because they've heard it and it makes them feel good too. So, all right. If a child has experienced trauma, one of the, in reality, that's a significant pain that they would carry. So using a painkiller to numb that is not an uncommon experience. So again, and that the more you become tolerant of, the more you have to be aware of the increased need. So that's when you go from your hydrocodone to your morphine to your oxycodone to your heroin to your fentanyl. And you can get fentanyl on the street, and people are using just pure fentanyl at this point in time because that's what's there. And it's cheap and it's easy to get. And it's also a killer. People overdose on fentanyl at a significantly higher rate than other medications, just because the dosage, it's such a little dosage that you need for overdosing, depending on your tolerance level. So being aware that that's out there, talking to our kids, talking to the teens that we work with about substance use, making a safe place for our teens to be able to have that conversation. Trying not to be judgmental and educate and support is important, because if they feel that there is a consequence as a clinician on talking to you about it, then they're not going to. And if they don't, they have no other outlet than the other people they're around who are also using. And then they're just, it's kind of more like an echo chamber about use instead of the education to be able to grow into, to have something different. Fentanyl, I guess I got ahead of myself here. Fentanyl is a synthetic opioid. It is 50 to 100 times more potent than morphine. It's prescribed in a form that's either patches, lozenges, but they're, again, finding it. It's not just in those forms, it's finding it in other ways, to other forms to be able to dispense in the community. Most recent cases of fentanyl related harm or overdose, death in the US are linked with illegally made fentanyl. It's sold through illegal drug markets for its heroin-like effects, often mixed with heroin, cocaine, or other products. Again, I'm always surprised by the people who are surprised that fentanyl was in their medication, in whatever drug that they had gotten, because it's not like there's an FDA specific formula to be getting what you're getting off the street. There are strips that if somebody that you know that does actively use, there are strips that you can use to dip into the substance itself to find out if there is fentanyl in it. So again, not that we encourage substance use, but meeting somebody where they're at in their use, even if there are adolescents, no matter how much we want people to make a different choice, their choice is their choice. And so trying to help them be as safe as possible. But, again, this hoping to get them before they even get to that point is kind of the purpose of where we're at today for this training. Heroin, again, another illegal opioid. Because opiates are so significant in our community and worldwide, they talk about the opioid epidemic. I wanted to make sure that we really outlined, it comes in prescription medications, it comes in fentanyl, it comes in heroin. Like, these are all things that we're experiencing in our community. And in reality, people that come in that say that they've been taking heroin, most of the time there's a lot of fentanyl in that. So people aren't even aware that they're taking that. It's harder to get heroin than it is fentanyl nowadays. But both of them are very deadly substances, because what it does is it suppresses your respiratory, your central nervous system. So you essentially forget to breathe. And that's what happens with overdose. Our children, if we have children that we know that have been using in our home, or that they're people that we interact with, letting them know about Narcan, The health department has a second chance program. So they have these free Narcan kits, which will help people come out of overdose until the EMS comes there. It's not something to be used exclusively. What we get, you need to not only use that to help get somebody out of it, but you also call 911 to have somebody come and have the EMS provide medical support. Smelling salts are something that we're seeing in our athletes. So smelling salts are used with their combination of ammonium and perfume. However, today's smelling salts are more likely contain diluted ammonia dissolved in water and ethanol. You can buy them on Amazon, so our kids have pretty easy access to them. Here are some of the, oops, I went too far. I guess that's our theme today. So some of the signs of using that is red eyes, runny nose, unusually smelling breath, head jerking, paint or stains on the clothing or the face. So like, because of the reactions, you also can get like a chapping from it, loss of appetite, appeared intoxicated, anxiety, the sores around the mouth. These are used with our athletes because you get this boost of energy for a very short period of time. Because again, it's used for somebody when they pass out. Use the smelling salts to revive them. What smelling salts do is they give you this boost of energy. So we're finding this in weightlifting, we're finding this in wrestling, we're finding this in football, that people are using these. So you can find little like cotton balls in the locker room or around the house, or you notice that your kids have these packets in their gym bags when they're going off to do their sports. To engage, because our athletes' performance is very important. We have come away from go have fun in the game to okay, go win. And that okay, go win sometimes comes at a cost to our children. And so that's where smelling salts can kind of play a role. Communication for parents, support from clinicians. Be open to discussing the cost and benefit of their drug use, being open to having those conversations, and communicate your beliefs open and honestly. Be open to communicating and having those problem-solving techniques. Start talking early. Middle school is not too early to have those conversations with our kids. Late elementary school to kind of just brief over. I remember my daughter talking about people having vodka in water bottles by the time she had gotten to middle school. She had the benefit of being raised by a clinical social worker that specializes in substance use disorders. So she got the education quite early and grew up with that. And also knew that she could talk to me, and her friends also knew that they could talk to me if needed. Because there wasn't a judgment. Having that openness to have those communications with the kids are very important. And as early as you can, as you're comfortable, because making that an open conversation, not something taboo that you don't talk about, really allows our children, our adolescents, our youth to be able to feel comfortable with talking to you about it. If you're a parent, get involved in your child's life, as Melissa had talked about. Never, ever in my life would I ever have thought I'd be watching anime. But now it is something that I regularly watch because that's who my daughter is. Making clear rules and consequences and being a positive role model. Monitor your children's behavior and using I statements, and make sure that you listen. And allow it to even have this almost humorous undertones, because we need to be able to have those communications with our kids. Problem solving. I know we're running short on time, so I'm just going to kind of brief through this. defining your problems, narrow it down and to the real problem with your kids. So sometimes they're like nothing, or they say, I just having problems with my friends. And what it comes down to is that their friends are doing drugs and they're not sure if they should be doing those, or their friends are going to a party and getting drunk. Brainstorming solutions, eliminate things that won't work, and talk about different solutions, kind of doing those problem solving skills with our children. And so they can learn. Here is prevention. Again, just responsibility for prevention belongs to the individual, not just school-based programs. And also it needs to be part of those conversations. So our child also needs to be part of that responsibility, but so do we. And again, just talking about the communities and other people. Here are some resources that we received this, and here is our reference page. So I think that I think we're pretty much right to time. If there's any questions, please let us know.
Yeah, there's a question here in the chat. It said, have you heard of a device called a Wizinator?
Are you there?
They're supposed to be used to avoid the detection of substance use. I had an individual court ordered that afterwards said he used them the entire time they were testing him. What would I need to look for? So if you guys have any experience with those kinds of devices.
That's what I was looking at. Wizinators. Oh yeah. So Wizinators are something that you can put with somebody else's urine in it. It comes up to your body, so it keeps your body keeps the urine at room temperature, and it actually looks like a penis. And so if you're being watched using doing a drug test, it would look like you're taking your penis out if you're a male, and just kind of creating, doing your urine drug screen, and it's the right temperature and it's the right device that you're going to be using. So therefore people don't question it. Another thing I've heard of is taking maxi pads, cutting them out, putting a baggie of urine, if you're a girl, up against you, because at that point in time it'll also maintain the temperature. One of the thick maxi pads, it can maintain the temperature, and then use that if you're not being closely monitored for doing drug screens, for urine drug screens. And said that there were two things, but I can't. Oh,
Melissa, you had said that
okay,
you might have a little time.
That's what I know about
the website.
You can get them online.
Are there any other questions?
Finish what you were saying, Shannon. Sorry.
I'm not sure where there is.
Yep. Not quite sure where our moderator is, but we are really coming to time. So thank you so much for joining us today. And I truly appreciate your interest in this area, and feel free to, return to this if you need the information again, because it was recorded, so it'll be on our website.
Thanks so much.
Yep. But hold for just a moment, and hopefully they'll come back on, because I'm sure they have a disclaimer.
Okay, thanks so much, Shannon and Melissa, for your time and all your info today. And thanks to everyone for attending this session. Our webinar today is one of many scheduled throughout the month of September. We still have a few coming up, and you can still register for these at sccmh.org. At the conclusion of this session, a pop-up will appear on your screen with a survey. Please take a minute to fill this out and give us your feedback, especially if you've registered for CEs. Thanks again for joining us today, and we'll see you all next time.